Welcome to the Supportive Management Practices webinar. Mental health is becoming an increasingly common discussion happening at companies and organizations nationwide. In a recent report by Mindshare Partners, we found that we're more likely to want to give support around mental health than to ask for it. But we often don't for a variety of reasons. Stigma, lack of understanding, not knowing what to do. Today, we're here to give you the tools as a manager to help you support yourself and your teams. We'll also debunk some common myths and gain a clearer understanding of what mental health is and how it shows up at work. Before we get started, we want to share a little bit about ourselves and the content of our curriculum. We are Mindshare Partners, a nonprofit changing the culture of workplace mental health so that both employees and organizations can thrive. We do this through movement building, professional communities, and corporate workshops and advising services. I'm Natasha. I work directly with organizations, advising and training leaders, managers like yourselves, and employees on how to create a culture of support for mental health.
And hello, I'm Bernie. I lead our organization's content research and expertise, which informs our training curriculum and online content. I also lead visual design and other special projects like our ERG community and 2019 report.
Our curriculum was developed by our interdisciplinary team of experts in business management and mental health and design, and has been developed in collaboration with our team of legal and clinical advisors, as well as input from real-life professionals living with mental health conditions. Finally, we want to note that the content of this webinar does not constitute medical or legal advice. It should not supersede recommendations provided to you by a clinician or a legal advisor. Okay, with that out of the way, let's get started. So today we'll equip you with the basic knowledge and skills to navigate workplace mental health in your company. We'll start by discussing what mental health is and how it shows up at work. Then we'll share 3 simple, concrete tools to get a start on creating a mentally healthy workplace at your company. Finally, we'll end with discussing your unique role as a manager in the context of mental health at your organization and other ways Mindshare Partners can help you and your organization create a culture of support for mental health. There's a handout attached to this webinar that summarizes some of what we'll talk about today, and also a space for your own notes. Be sure to print it out and post it somewhere you'll see often as a reminder to keep mental health top of mind. Before we get into the truths about mental health, we want to ground ourselves in empathy. So let's take a second to reflect. Think of a time when there was something you wanted to talk about at work, but you couldn't for whatever reason. Or you felt like you needed to be 100%, but you couldn't. You felt like you had to hide something. What did that feel like? What do you wish someone had said to you? You may feel as though mental health is not part of your experience, but we all know what stigma feels like. When we're talking about mental health in this context, the thoughts and feelings that come from stigma extend to many experiences. We all have something we felt stigmatized for. And as we go through the training today, I urge you to come back to this as a point of empathy. I'm going to hand it over to Bernie now to talk about what mental health is and how it shows up at work.
The 3 truths of workplace mental health. With the rise in conversations about mental health happening in companies, oftentimes colloquial understandings and impressions of mental health can get conflated with the real lived experiences that are often supported by research. In this section, we'll unpack common portrayals and misconceptions about mental health, particularly in the workplace setting, and share the truths and realities of what mental health at work actually looks like. To start, let's think about how we typically see mental health being portrayed in popular media. Increasingly, celebrities have come out sharing their own experiences with mental health conditions. While this is a start, oftentimes the impression is that mental health is something that affects creatives and artists in Hollywood. Simultaneously, we commonly see mental health portrayed in the context of shootings, homelessness, and the opioid crisis. While these are serious challenges that our nation faces, these portrayals can imply that having a mental health condition necessitates violence, drug abuse, and the inability to function in society, which is often not true. And finally, common misconceptions about mental health even come down to the imagery we see in the media, as you see here. Clearly, there's a lot of head holding, windows to dark corners, and an overwhelming lack of diversity in how mental health is portrayed as well. So when we look beyond popular media and into the research and real lived experiences, what does mental health actually look like? Myth 1, mental health is something you either have or don't have. We often think of mental health as something we have or don't have, only thinking about diagnosed conditions. Historically, conversations in the workplace about mental health have been a bit dichotomous. Oftentimes, they can fall into just talking about stress and wellness without getting into serious mental health challenges. Research shows that this can actually alienate people who are facing those serious challenges and need that support. On the flip side, conversations can actually fall into this notion of having a condition or not having a condition as a measurement of being healthy or not. In reality, mental health is a spectrum, and this is our first truth. Mental health encompasses the positive and negative across a variety of experiences, across a variety of contexts, from diagnosed conditions, to burnout, to depression, anxiety, stress, even worry, and to general wellness. There's a lot of variability. Ultimately, diagnoses are lines drawn in the ground based on clinical criteria, but it's not a black and white determination of health overall. It's important to know that everyone exists on the spectrum of mental health as well, and everyone moves along this spectrum over the course of their lives. Research says that most people, up to 80% actually, will develop a condition at some point in their life. Some may experience a bout of depression after a death in the family, or face burnout after a particularly difficult time in a toxic work culture. Many of those will recover with or without treatment, and some will manage condition on an ongoing basis. One question we often get at Mindshare Partners is what the mental health spectrum looks like in the workplace context. And there are 4 big buckets of the ways mental health conditions manifest. There's behavior, cognition, emotion, and performance. So think about what you might see in a colleague that would fall into these buckets for someone who might be struggling. Here are just a few examples that we're going to show on the slide. It's important to note that we often think about mental health as negative qualities or negative symptoms, such as difficulty remembering, missed deadlines, and other symptoms. But also note that some of these signs are positive, such as intense focus or long bouts of productivity. As humans, it's tempting to see this list of signs and symptoms and want to start diagnosing our colleagues and figure out what conditions or symptoms they might be struggling with. And this is natural because we like to make sense of the world around us. But just stop and think for a moment. What else could these be a sign of? These could all be a sign of a bad breakup, a bad night's sleep, having children who kept you up all night. There are countless reasons that could lead to any combination of these signs. Ultimately, you can't tell what mental health condition someone has by how they behave and how they present. And as managers, it is never your job to diagnose your employees. As a colleague, a manager, or a leader, our role isn't to act as clinicians. It's to create a supportive environment at work, regardless of whether a condition is present or not, and create an environment where all employees can thrive and seek support when they need to. So ultimately, a more sustainable approach then, and what's within your scope as a manager, is to create an open and flexible environment that accommodates and adjusts and enlivens the diversity of colleagues and employees, regardless of their identity and health status. So let's move into a personal reflection. Before we go into the next section, let's take a look at the statements on this slide. Quickly jot down your best guess at the percentages based on these statements. If you need more time, pause now and resume when ready. All right, let's continue. So these statistics bring us to our second myth. Mental health symptoms and conditions are rare. Often, people think that mental health affects only a small subgroup of our population. We tend to have a belief that mental health symptoms and conditions are rare. And in reality, mental health symptoms and conditions are actually really common, and this is our second truth. Annually, 1 in 5 people manage a diagnosable mental health condition every single year. The most common conditions include anxiety and anxiety-related conditions like generalized anxiety disorder, depression and mood disorders like bipolar disorder, impulse control disorders like ADHD, and substance dependency, which is an especially common coping mechanism for many working professionals. But as we mentioned before, mental health is much more than diagnoses. In Mindshare Partners' national survey of working professionals, 60% actually reported having struggled with a mental health symptom in the last year, compared to the 20% who managed a diagnosable condition. Additionally, these symptoms were just as prevalent across seniority levels at companies, including junior independent contributors up to senior executives as well. What's more, a 2017 research publication that compiled estimates from multiple studies found that 80% of Americans will have experienced a mental health condition at some point in their life, whether or not the condition was temporary or if they received a diagnosis. For managers, this means that a vast majority of your incoming workforce has had some sort of experience with a mental health condition. But how often are conversations about mental health actually happening in the workplace? Likely it's very little. So let's think back to the reflection we did and let's review. So we have 20% of people managing a diagnosable mental health condition every single year, and 60% of employees experiencing symptoms of a condition in the past year. And the truth is that mental health challenges are equally prevalent throughout seniority levels of the organization. And think about that for a minute. That means that in your company, it's just as likely that someone on your team and one of your senior leaders is experiencing mental health symptoms. Finally, this takes us to our last myth. Mental health symptoms and conditions are always serious, lifelong, and debilitating illnesses. Think back to the images we saw at the beginning of this webinar, the homeless, the acts of violence, and shootings. Historically, mental health symptoms and conditions were thought to always be serious, lifelong, and debilitating illnesses, but the evidence shows that this assumption affects only a minority of cases of mental health. In reality, many people thrive while managing mental health symptoms and conditions, and this is our third truth. So first, only a minority of mental health conditions are actually considered serious at a clinical level. We learned in the last section that 1 in 5 people manage a diagnosable mental health condition in a year, but only a fifth of these cases are actually considered serious or by the level of impairment on that individual's ability to function. This means that a majority of diagnosed individuals are functioning in some way, and for many, perfectly successful. So for you as a manager, this means that having a mental health condition or an employee who manages a condition does not equate to lower functioning. Second, a vast majority of mental health conditions do not have to be lifelong. Oftentimes, the impression is that mental health conditions is something you'll have to manage your entire life. Sometimes it is, but the WHO estimates that up to 80% of people can live completely symptom-free with the right treatment. The challenge instead is around stigma then, how we don't talk about mental health, and as a result, we don't detect mental health conditions early enough. People only end up getting treatment once a condition starts to have a serious impact on their life. So again, for you as a manager, this means that we should proactively create a supportive culture for mental health to eliminate that stigma that keeps people from getting support, whether they be job accommodations or more clinical support. And third, mental health conditions are not always debilitating. In fact, a recent study out of VCSF found that mental health conditions are just as prevalent, if not more so, in high-performing individuals like entrepreneurs. As mentioned before, we found in Mindshare Partners' national survey that there was no difference in the prevalence of mental health symptoms from senior leaders to managers to independent contributors. Mental health symptoms affects all levels of professional status and functioning. In fact, many individuals managing mental health conditions actually say that their experience have been an asset in the workplace. So let's move on to another personal reflection. So listed here are symptoms typically tied to common conditions like depression, anxiety, and bipolar disorder. Again, oftentimes these symptoms are framed negatively. But think to yourself, how might they actually be advantageous in a professional setting? So feel free to pause now and to reflect and continue when ready. All right, let's continue. Based on feedback from Mindshare Partners focus groups, many symptoms of mental health conditions can actually be assets in the workplace. For rumination, people have described their ability to think deeply and comprehensively, while also playing devil's advocate to overly optimistic predictions. For hyperactivity, which has been associated with an inability to focus, many people have described their ability to multitask and to be productive, especially when having to juggle a variety of responsibilities. And for anxiety or worry, we've heard that these symptoms can actually help people focus on the details and avoid losses due to the risk aversion. So for you as a manager, we've been socialized to attribute a lot of negative qualities with those with mental health conditions. Really understanding this misconception allows you as a manager to think beyond the mental health status of your colleagues and direct reports and how mental health might be negatively impacting their work. Instead, you can focus on the whole human and individual with their strengths and challenges, whether or not they have a condition. Finally, it's important to note that mental health conditions show up differently between individuals and affects different demographics and communities in unique ways. For example, women are twice as likely to experience depression, anxiety, and PTSD, while men are twice as likely to develop alcohol and nicotine dependency. The LGBTQ+ population is 3 times more likely to experience a mental health condition compared to the general population. And many racial and ethnic groups face unique cultural stigma and language barriers that prevent discussion and help seeking. What's more, many groups that have been historically underrepresented in the workplace also face common challenges when it comes to mental health, ranging from experiences of discrimination, cultural stigma, and lack of access to quality and cultural sensitive care. In summary, navigating mental health at work is less about knowing each individual condition and figuring out what a mental health challenge looks like for each individual person. The main takeaways is to remember and understand these 3 truths, which are also included in the handout provided to you. It's important to remember that mental health is a spectrum. It looks like a lot of different things, so don't focus on diagnoses. It's important to remember that mental health symptoms and conditions are really common and affects almost everyone. And finally, it's important to remember that many people thrive with mental health symptoms and conditions, and mental health shows up in many different ways. It's treatable. You can be a successful professional with mental health conditions and symptoms as well. So this wraps up our first segment on the 3 truths of mental health at work. In our next section, we'll delve into mental health stigma and actionable tools you can leverage to create a supportive culture of work for mental health at your company.
Thanks, Bernie. Okay, so let's do a personal reflection and contextualize what we've learned so far about mental health at work and our own immediate work circle. Take a minute and count the number of people you've communicated with in your company, whether that be over email or in the kitchen. So this is thinking about your immediate team, perhaps those in other departments, your manager, their manager, folks you see as you walk into the office. Just count all of those up. Come up with a number. Might be 10, might be 100, and hold that number in your head. Okay, so now consider the statistic that Bernie shared, that 1/5 of those people may likely manage a diagnosable condition every year, right? So do that math, 20% of that number. Now write that number down. Okay, now remember that Bernie told us, right, that in our survey, we found that 60% of people will experience symptoms in a year. So now do that math again. That number should be getting a little bit higher. Write that number down too. Now that's a pretty big number, right? Now reflect on how many of those people you know had a mental health condition or symptom because they told you. Write that number down. Now I suspect when you compare those numbers, there's a pretty big discrepancy. I suspect that the number of people who have told you they have a mental health condition or symptom is quite small. I work in mental health, and that number is quite low for me. What does it say about our culture when so many people are affected by mental health, but there are so few conversations happening about it? We'll get into this a bit later, and we're not here to promote a culture of uniform disclosure. We can never force people to disclose. It's a personal decision. But we are here to talk about how to create a culture in which people feel that mental health is normal and that they can speak about it if they need to and get the support that they need. So what is stigma exactly? It's both the real and anticipated negative responses and associations to mental health conditions and mental health symptoms. Stigma is real and it impacts work, sometimes even more than mental health conditions themselves. So let's take a look at what this means. 95% of those who take time off for stress have named another reason, such as an upset stomach or a headache. This means that many of your employees are hiding the impact that mental health has on themselves and their work. 10 years is the average delay from symptom onset to seeking treatment. 10 years. Just let that sink in for a second. We all have friends, or maybe ourselves, who don't always go to the doctor when we have a cold or not right away. We've waited a little bit. But 10 years is an incredibly long time to be experiencing mental health symptoms and not seeking treatment. And this shows up in how employees stay or leave their jobs and on real impacts on productivity. So 20+% of people have voluntarily left jobs for mental health reasons. This is a finding we saw in our recent National Mental Health at Work survey. And this number increases even higher than 20%, going up to 30% and almost 50% when you look at millennials and Gen Zers. And what this means is we lose $17 billion each year in productivity. So why is it hard to talk about mental health at work? There are lots of reasons why it can be hard to talk about mental health at work. Maybe we're in a work environment where stress and busyness are badges of honor. Maybe we're in a culture where talking about these types of issues is considered too personal or inappropriate. Maybe we've never heard about our colleagues talking about mental health, or if we have, it's only using words like crazy carelessly. Or maybe we just feel like it's a bit awkward and we don't really know how to start the conversation. As a manager, it's important that you're aware of these driving factors of stigma and being intentional about creating safe spaces, cultures, and workflows that minimize their impact on health. We're going to talk in just a little bit about how you can do that as a manager. Before we do that, let's pause and read a story. I'm going to turn it over to Bernie to share.
Of course. In the last few years, I've been very open about my own story with mental health. As a person of multiple identities, gay, male, and Asian American, I've had a lot of barriers to talking about my own mental health. Historically, men aren't socialized to be emotionally expressive, to be tough. As an Asian American, son of Chinese immigrants, my struggles seemed minuscule compared to those of my parents. And culturally, we never talked about mental health either. I remember my parents struggling to translate mental health into Cantonese when I initially asked them. And as an LGBTQ+ person who grew up hiding this part of my identity for most of my life, I've been very used to putting forth the most confident and competent image for fear of any parts of these identities being seen as weaknesses.
Thanks, Bernie, for sharing that. Let's do a personal reflection now. Take a minute and reflect on your own experiences and how they affect your ability to talk about your mental health or your desire to be more or less open. There's no right or wrong answers here. This is just about reflecting on our experiences and how they might interact with the stigma that surrounds mental health. Feel free to pause the recording if you want a bit more time. So today we're going to start talking about how we can use tools as managers to create an open culture in our teams. I'm going to reiterate again that we're not here today to promote a culture where everyone is unequivocally open and transparent about anything that's going on in their lives. Not everyone wants to be open, and that's absolutely fine. We are here to talk about these barriers that shame, fear, and stigma cause, and how we can collectively break them down. As we mentioned in the beginning, our recent survey also told us that we're twice as likely to want to help someone than to be able to ask for that help ourselves. We want to help, but the stigma surrounding mental health makes it difficult. What's more, and really internalize this fact, in a recent study, it was found that 97% of senior managers believe they are accessible if employees want to talk about mental health, but just 11% of employees discuss their most recent period of poor mental health with their line manager. Again, this is not about everyone being open. It's about you as a manager creating an environment where people can get the help that they need and that stigma and shame is not there. So let's get into what you can do as a manager. Earlier, we talked about how it's not anyone's role at work to diagnose people. So what do you do if someone on your team looks like they might be struggling? In this section, we're going to talk about 3 concrete tools to support mental health at work. This is geared toward a general manager audience, so tailoring these approaches to your work culture and investing in additional trainings, initiatives, and programs will be what creates lasting culture change in support of mental health at your company. So take a minute and pause and reflect on, and maybe this has already happened to you in the past, imagine someone in your company or your team is struggling. And what do you do to start that conversation? Let's listen to 2 examples of how this conversation might go. As you're listening, reflect on what you're hearing and any differences you notice between the 2 conversations.
Hey Ken, how's it going?
It's going all right. How about you?
I'm pretty good. Thanks for taking the time to meet today. The reason I wanted to check in is that I noticed your performance has been slipping in the last couple weeks, and you've also seemed kind of quiet at work. Is there anything going on?
Oh, sorry. I just haven't been getting much sleep lately, and I've had some other personal stuff going on. I'll work harder this month.
Yeah, that would be great. I'm sorry to hear that you're not getting much sleep. Is there anything causing that? You've also seemed a little bit down.
No, I don't think so. There's just a lot of life stuff, but I think I'm okay.
Okay, well, just let me know how I can help. Hey Ken, how's it going?
Doing all right. How about you?
Glad to hear it. I'm doing okay. Thanks for taking the time to meet today. I wanted to check in because I've noticed you've seemed quieter than usual at work recently, and I just wanted to see how you're doing.
Oh, sorry. I've just had some personal stuff going on, and because of that, I haven't really gotten much sleep lately.
Thanks for sharing that. I'm really sorry that you haven't been getting much sleep. I can definitely relate to that. I had some family stuff going on last year that gave me a bit of anxiety. It made it hard to focus at work sometimes, let alone sleep. Is there anything I can do to help you?
Oh, wow. I didn't realize that. Thanks for sharing. Yeah, I'll think about it. Honestly, I've just been feeling kind of down. I think right now the biggest challenge is just making it to work early, which kind of affects my energy the rest of the day.
Totally get it, and I really appreciate you sharing that with me. I know we set some aggressive goals this month. It's important that we continue working toward them, but I really want to make this work for you. Would shifting your schedule an hour later for the next few weeks help?
Yeah, that'd actually be really great. Thanks so much.
Got it. Well, let's try that out and then check in again in a week or 2 to see how it's going. And I'll also try to think of some other ideas to support you. Happy to check in sooner if it would be helpful.
Okay, so hold on to those notes where you wrote down some of the differences between those 2 conversations. We're going to break down 3 tools right now, and we're going to think about how these are showing up in these conversations or not. And then we'll hear these conversations again at the end. So you'll be able to come back and think about what you saw initially and kind of how that plays into those tools. So our first tool. So someone on your team is struggling and you're trying to think about how you open the conversation with them to see how they're doing. Our first tool is that it's important to be doing this over time. So you can't just approach someone out of the blue and talk to them and see how they're doing. You can, but it's probably going to be a bit harder. What can be incredibly powerful is to proactively be pairing vulnerability, I'm not doing well today, with a genuine ask of how someone's doing. How are you? Right? So this phrasing in particular is really important. It's pairing that vulnerability with that genuine ask. You want to set the norm of checking in over time and pairing that honesty and vulnerability and genuinely asking. Now, for some of you, this might feel really intuitive. Maybe you check in with your teams all the time. But for some of us, this is a bit hard. We ask people how they're doing all the time in life, but we tend to not even really listen to the answer. This is something really different. Here's why this works. Modeling the behavior of sharing honestly how you're doing over time, whether it's mental health related or not, sharing a time that you had a hard go at things, that really opens the door for people to feel like they can share something with you. It's especially important for you as a manager of your teams. The second part, asking how are you, sincerely and genuinely, again, over time, establishes the norm of talking about how people are doing and opens up the door for someone to tell you if they're struggling, particularly if you've modeled that vulnerability. And don't be afraid to get specific. For some people, just asking how they are isn't going to be sufficient to allow them to open up. You might want to be able to say, do you feel supported? I'd love to talk about how you're doing. How's your stress level? How's your balance? There are lots of ways to think about asking this question. And we'll talk a little bit later about how you can set a norm of understanding when people are at their best to make it even easier for you to ask this question in different ways. It's important to keep in mind that you might not get a response, or you might get a response that you're not expecting. Sometimes it takes multiple conversations before someone feels comfortable opening up, and sometimes they'll never open up. But by creating this environment of vulnerability and genuine interest, you're reducing that self-stigma and creating emotional safety, and that's critically important. So let's think back to those two conversations. In the second one, Priscilla offered her own story. She shared the ways in which she's had a challenging time at work and asked multiple times how Ken was doing and really listened to that response and did something with it. Often, where we see people get stuck is on the conversation that follows. What happens when somebody's acutely struggling and you feel like you really need to get to the bottom of it, and you're trying to react to that? And that's hard because at work, we're not only people, but we're also professionals, and we're subject to regulations, which can feel a lot less intuitive. So often people and managers feel frozen because you're afraid of breaking rules, and because of that, we might avoid trying at all. Luckily, this next tool is going to help us. Some of you might be familiar with the Americans with Disabilities Act, or the ADA. What that says are these three items here, right? So we can't force employees to disclose, and employees don't have to disclose. We've mentioned that a couple times today. Employers can't discriminate against people with mental health conditions, and employers are required to provide reasonable job accommodations. This can feel like a lot of legalese. But let's break this down with a rule of thumb to think about when you're talking to your teams. What we say is be curious about the impact, not the cause. This is our second tool. Asking someone specifically how they're doing when you think they might be struggling can be really hard. Asking how are you over time, as we discussed in the prior tool, will help you set the norm for this. But what can you say specifically? You can always be curious about what is happening at work. So what you're observing. You should never ask or force information about why. So in the next couple of slides, we're going to see some statements. And as we're going through them, Bernie's going to read them for us. Reflect on whether they align with this second tool. Be curious about the impact, not the cause. And reflect on how you might adjust them if they don't.
Hey, you've seemed down lately. Are you depressed?
So what's challenging about this? A couple of things. They're explicitly asking why, and they're pointedly asking someone if they're depressed. This is not something you want to do, right? Something you might say instead is, I've noticed you've been a bit quieter in meetings lately. Is there something about the way we're holding meetings that isn't aligning with how you work best? Again, you want to pair that being curious about what's happening at work and then really genuinely trying to find a solution with your team member. Let's try a second one.
You've been trying to get this project done, and it's a bit hard with you missing so many meetings. Is there a reason you're acting this way?
So how about this one? So parts of this do have the be curious about what's happening at work, right? We've been trying to get this project done. You've been missing so many meetings. We can debate if that's the nicest way to ask that, but it is observing something that's happening at work. This second part, is there a reason you're acting this way, starts to get into that why, and that's what you don't want to do. Instead, what you might say is, I've noticed you seem a bit distracted and you've been missing several meetings. How can I help you so that you're able to attend meetings? Or how can I help you manage your workload so that you're able to attend meetings, right? Again, you're talking about what's that observable thing that's happening and how can you start to try to help them as their manager. Let's listen to a third one.
Hey, you don't seem like yourself lately. Is everything okay?
So this one pairs that being curious about what's happening and genuinely asking how someone's doing. So this is a good example. This is something you could say in an example conversation that you're having with an employee. Now, this might not feel like natural phrasing to you, and that's totally fine. And so we want to encourage you to think about something that you could do to open up a conversation with your team member. Think about specific language that you might use. And think back to that first tool also. What are ways in which you could practice vulnerability over time so that you're modeling that vulnerability for your teams? So just pause now and feel free to pause the recording if you need a little bit of extra time. And think about specific language that you might use to open up this conversation where you're being curious about what's happening at work, but not forcing information about why. And then second, reflecting on how you can be more vulnerable to really create the norm that checking in over time is a thing that you want to do, and also that you're also not always 100%. Okay, now think back again to those audio stories we heard. In the first story, Priscilla really focuses on performance first. Whereas in the second, Priscilla is being curious about the impact that she's seeing in Ken's work and creating the space for Ken to share and ask for help if he needs it. As we mentioned before, a person might not always open up, but making checking in on how someone's doing normal and frequent can elicit a genuine response and help support an employee proactively before it becomes a more significant issue. So let's say you've had the conversation, you've been vulnerable, you've been curious about what's happening, and somebody does share something with you. Now what do? This brings us to our third tool, being flexible. So we're going to talk a little bit about that third part of the ADA, accommodations. What we're talking about here is both being flexible with those accommodations in partnership with HR, but also thinking more proactively about adaptations. So accommodations, what are these? These are official company-sanctioned parameters for an employee because of a disability. So again, this was a part of that ADA that we shared. When an employee comes to you in need of an accommodation, it's important to work with HR and the employee collaboratively to develop a solution. When there's a partnership between you as the manager and HR and the employee, this creates a better rapport and experience for the employee and often leads to better solutions. It can be really tempting to just hand off an employee to HR, but they're not going to feel that safety and that real genuine concern that you want them to succeed without that partnership. Sometimes we think the employee should come up with an answer, and the employee might have ideas, and that's a great place to start if they do. But remember back to that slide where Bernie was talking about some of the symptoms of mental health symptoms and conditions. When you have a mental health condition or experiencing symptoms, some of that might be difficulty with cognition, difficulty with decision making, right? Not a great place from which to come up creatively about solutions for what you need. So again, think about this being a collaboration between you, HR, and the employee. Now again, think back to the audio recordings we heard. In the second one, Priscilla, Ken's manager, offers solutions proactively and then offers a time to come back and revisit those with Ken. That gives Ken a chance to think about if that's a good solution. It also gives them a chance to test as a team if that's something that's really going to help Ken and be consistent with the team's goals. Remember that there's more to accommodations than leaves of absence and EAPs. These are incredibly important resources, but they're not sufficient. And often this is the first place we go. Different conditions may require different flexible working options. I want you to think just really quickly, this is going to be a really quick one, about if somebody told you you couldn't offer a leave of absence or an EAP, hopefully you can, but let's say you couldn't, what are just 5 quick things you could offer someone? And you can think back to the recording and the offer that Priscilla made. Okay, so here are a couple of common accommodations. Again, remember to work with HR on this. A couple of these to really point out is time for therapy. So therapy can be an incredibly important tool for folks who are managing mental health conditions, and often therapists only have appointments during the day, and so it can be quite challenging to get out of work to go to an appointment. So this is one way that you can help folks. Allowing folks to take breaks, or that's included here, shifting in a schedule. So this is something that Priscilla suggested for Ken. Note that many of these are low cost and relatively easy to implement. So accommodations, sometimes a leave of absence is the right answer, sometimes it's not. And you can think more flexibly and more creatively in partnership with your HR department about what's going to be best for that employee. But here's the thing, Accommodations are inherently reactive, right? The only way you're offering an accommodation to someone is if they've come to you the way Ken came to Priscilla and actually asked for an accommodation. So what can managers do to support individuals before a problem has occurred or before someone's struggling? This is where adaptations come in. Adapting is creating reasonable flexibility for people to perform their jobs according to their work style preferences and needs. This is a proactive solution. Don't wait to address individual working styles or needs until an employee needs HR-sanctioned accommodations. There are many benefits to this. People who don't feel comfortable disclosing a mental health condition might be able to find ways to self-solve within a more flexible environment without having to ask for an accommodation. It also won't stick out so much if somebody else on your team has an accommodation, if the rest of the team also has flexible ways of working. And that's important because if people start to notice that accommodation, it's a bit like forcing that employee to disclose, right? So again, these are tricky territory, always involve HR if you're not sure of what to do, but do think really creatively about what you can do within your scope as a manager to create that reasonable flexibility for everyone. So let's think about what some common adaptations are. So here are a couple. Working style sheets is something that we do at Mindshare Partners. So when someone new joins the team, we have a discussion about what's important to them outside of work and what are certain ways and working style preferences that they have in work. That really allows us as a team to check in if we notice that something isn't really happening, or if somebody is really struggling and those things don't seem to be jiving in the right way. It makes those check-in conversations a lot easier and more natural. The second one on here, manager modeling, is something we're going to keep repeating. If you don't actually model these behaviors, your teams aren't going to feel like they can actually do them. And we'll talk more about some specific ideas. So pause for a second and think about adaptations you as a manager could implement proactively to support the flexibility in your teams. You might already be implementing adaptations without have ever really thinking about it. And think also about the constraints within your jobs, right? One of the places we go often, or we hear companies go when they hear this, is to name all the constraints that exist in their job. Maybe it's a 24/7 work environment. Maybe it's a legal firm with billable hour requirements. There are lots of constraints in the world, and those constraints are important. So think about what those are, and then think about flexibility within them. A lot of these things can be applied to just about any working environment, or there are ideas that are going to be really specific and particular to your work environment. So pause again and think about this for a second. Feel free to pause the recording if you need more time, but we're going to keep going. Now I'm going to come back to this manager modeling one. Think about email after hours. Probably all of us have said to our teams, please don't email after 5 p.m. or 6 p.m. or whatever your hours happen to be. But then we send the email at 9 p.m., right? And if you're on a team and your manager is emailing you late at night, but has told you that you shouldn't be emailing late at night, you probably still feel the need to respond. So what we do as managers can really send a strong message to our teams, and that's really important to remember. Your team will not feel like they can truly unplug unless you do. You're really setting the norms and culture for your team. We're going to come back to this again in that last section, your role as a manager, but really internalize this one. Now, one final reminder before we move on. Again, remember that if support moves beyond adaptations and starts to get into the zone of accommodations, you always want to involve HR to make sure that you're really helping, they're able to help you implement this with the employee. This should be a partnership between the individual, the manager, and the HR department. Okay, so we've discussed these 3 tools to help you support mental health in your one-on-one conversations and in your teams. Be vulnerable. Learn to say, I'm not doing well today, how are you? Pair that vulnerability of times you haven't been great with genuinely checking in with how your teams are doing over time. Tool 2, be curious. Remember to balance being compassionate and compliant by always being curious about what's happening at work, but never forcing information about why. And finally, be flexible, both being proactive about adapting your workplace and thinking creatively about accommodations in partnership with HR. Now let's bring this all together by revisiting those 2 conversations we shared before the tools. As you're listening to these 2 conversations, reflect again on the notes you took initially as well as the differences you see between the two conversations and how these tools are showing up. One last note, remember that these 3 tools are in your handout, so you can have them handy to refer to while you're listening to the stories and also after this webinar.
Hey Ken, how's it going?
Going all right. How about you?
I'm pretty good. Thanks for taking the time to meet today. The reason I wanted to check in is that I noticed your performance has been slipping in the last couple weeks, and you've also seemed kind of quiet at work. Is there anything going on?
Oh, sorry. I just haven't been getting much sleep lately, and I've had some other personal stuff going on. I'll work harder this month.
Yeah, that would be great. I'm sorry to hear that you're not getting much sleep. Is there anything causing that? You've also seemed a little bit down.
No, I don't think so. There's just a lot of life stuff, but I think I'm okay.
Okay, well, just let me know how I can help. Hey Ken, how's it going?
Going all right. How about you?
Glad to hear it. I'm doing okay. Thanks for taking the time to meet today. I wanted to check in because I've noticed you've seemed quieter than usual at work recently, and I just wanted to see how you're doing.
Oh, sorry. I've just had some personal stuff going on, and because of that, I haven't really gotten much sleep lately.
Thanks for sharing that. I'm really sorry that you haven't been getting much sleep. I can definitely relate to that. I had some family stuff going on last year that gave me a bit of anxiety. It made it hard to focus at work sometimes, let alone sleep. Is there anything I can do to help you?
Oh, wow. I didn't realize that. Thanks for sharing. Yeah, I'll think about it. Honestly, I've just been feeling kind of down. I think right now the biggest challenge is just making it to work early, which kind of affects my energy the rest of the day.
Totally get it, and I really appreciate you sharing that with me. I know we set some aggressive goals this month. It's important that we continue working toward them, but I really want to make this work for you. Would shifting your schedule an hour later for the next 2 weeks help?
Yeah, that'd actually be really great. Thanks so much.
Got it. Well, let's try that out and then check in again in a week or 2 to see how it's going. And I'll also try to think of some other ideas to support you. Happy to check in sooner if it would be helpful.
Great. So what was the main difference in how Priscilla approached Ken and how she broached the topic? In both instances, Priscilla was ultimately trying to be helpful and observes things happening at work. But in the first recording, Priscilla led with performance issues, and the conversation quickly became one focused on giving an explanation of why. In the second recording, the focus instead was on how Ken was doing and how Priscilla could help him thrive and succeed, all the while maintaining the goals of the team. So let's walk again through each tool. With Be Vulnerable, Priscilla gave a personal share of her anxiety that allowed Ken to open up more if he felt that he wanted to. And she also asked how Ken is doing genuinely. Notice that she did this multiple times. This may also need to happen multiple times over multiple conversations. And the personal share doesn't need to be about mental health. Just remember that vulnerability can also show up in how we act, not just what we say. Now the second tool, Be Curious. She talked about the impact, seeing Ken act quieter, but she didn't talk about or ask about the cause. She kept it quite open-ended with a how you're doing question. And Be Flexible. Priscilla suggested a tangible solution that maintained expectations, but solved for the challenge Ken shared with her. And she offered to check back in to iterate on that solution. Remember that if this becomes an official accommodation, it's important to check in with HR. Of course, these conversations won't always play out this way. It may take a few conversations over time, and a genuine answer doesn't come out of nowhere. The ability to have an honest conversation takes time to build trust. A work relationship based on trust and safety allows managers to flexibly adapt to employees' needs as we all move across the mental health spectrum. It's also okay to not know exactly how to respond right away. And in those situations, if you need more time to think about it or you need to consult your HR team, you can say something like, I appreciate you sharing this with me, and I want to process this more so I can be helpful. And suggest another concrete time that you can come back and finish the conversation with your team member. Now, with those 3 tools, let's talk a little bit more beyond those conversations in one-on-one situations or in your team about what your role as a manager is in your organization in terms of creating an embedded culture of mental health. So we're going to share Mindshare Partners framework for creating mentally healthy workplaces. Name, normalize, and navigate. And the manager's role, or your role in this. So first, naming mental health. Oftentimes when we see companies talking about mental health, we see them focusing on wellness and stress. And those are necessary things that need to be named. But studies show that programs that only target wellness broadly can actually alienate those facing more significant challenges. Naming mental health specifically makes it an okay thing to talk about and helps spark real and genuine conversation. So don't be afraid to use the words mental health at work. Doing this consistently not only makes it normal to talk about mental health at work, but also encourages others to share as well. Remember to show up for conversations about mental health. Whether or not you have a mental health condition and whether or not you're actively experiencing stress or burnout or any other mental health challenge, showing up as an ally for conversations, events, employee resource groups, other support groups or resources around mental health at your company shows that you're an ally and that the issue matters to you. This is important for your team to see. Finally, communicate the need for mental health resources and a supportive workplace environment to senior leaders. You can both advocate for these resources and share them with your team. You're a bridge between your direct reports and the senior leaders of your organization, and you have the opportunity to share the importance of supporting mental health to inform decision-making. Regularly communicating the need for mental health resources maintains the issue on senior leaders' radars and make sure that you're also sharing the existing resources with your team. Our second piece is normalizing mental health. There are a few ways to normalize taking care of your own mental health at work. First, regularly encourage employees to practice self-care around their mental health in real ways. Research tells us that employees only really use health benefits at work if they've heard vocal support by company leadership around using these benefits. And the key is consistent supportive messaging. Self-care habits are going to differ by person, but as an example, this can mean taking breaks or actually taking your paid time off, building community within your team, exercise, sleep, lots of different things for lots of different people. Second, perhaps just as important, if not more, is managers modeling these healthy behaviors at work as well. Employees look to their managers and senior leaders to evaluate what the company norms are. Even if you encourage employees to take time off or not answer email after hours, if you do so, you're signaling that that behavior is still the norm. Managers need to practice self-care themselves visibly and show that it's okay and normal to do these things. Taking care of yourself can also mean professional care like therapy. When talking about professional care or seeking support from a therapist or mental health professional, we're often asked, how do I know if I have a real problem? When people ask us this, what we really hear is, when should I get help? It can be helpful to pause and ask, is my mental health where I want it to be? You don't need to have a diagnosed condition to seek support, no matter what the cause is. You can be stressed from any natural life event and still get some help, whether that means regular therapy, one therapy appointment, occasional appointments. It doesn't matter. Support can look like a lot of things. Getting support can also include a community of support around you, your friends, family, colleagues that you know you can go to for support when you're going through a challenging time. Your job as a manager is to encourage the use of benefits and resources available to employees. Again, employees need to hear that these are things that are okay to use from their leaders and managers to actually use them. Make sure that your team knows what the company offers and make it feel normal and okay to leverage these resources. Now, it's important to remember that there may be times when you or another individual might be experiencing a serious mental health crisis, such as a serious panic attack, episode of psychosis, or serious suicidal ideation. In these instances, your role is to contact emergency care, whether that be 911, a mental health hotline, or your mental health care provider. Now, finally, navigate. We've gone through 3 tools today about how to have conversations and create flexibility within your teams to really be able to create support for mental health in your teams. And this is what we're going to reiterate as navigating again today. This is how you can really create a psychologically safe and inclusive team culture. So be vulnerable, be curious, and be flexible. This synthesizes the name, normalize, navigate framework again. And remember that this is something that's also on that handout that you can post somewhere to keep top of mind. So as we close, stop and think about what you can start doing to implement change now. What is one thing you can start doing tomorrow? This might be one of the suggestions we named here. Maybe it's starting to check in with your team members in a more ongoing, vulnerable, and genuine way. Maybe it's naming mental health and making the case for why it's important at work to your colleagues and leaders. Maybe it's implementing adaptations in your team that allow for greater flexibility. Or maybe it's just thinking about how you as a manager are modeling the behavior and the environment that you're trying to create. Or it might be an entirely different idea. But I'd encourage you to pause now and write down one idea for a change that you can make, the steps you'll take to get there, whose help you might need, and how you hold yourself accountable. You as a manager have a really important opportunity to be the beginning or the continuation of creating a culture of support for mental health in your team and in your organization. Today we discussed some realities about mental health and tools to support yourself and teams. Remember to download the handout that summarizes what we've talked about today and post it somewhere around your desk, somewhere that you'll see often and be reminded of supporting mental health on a daily basis. We also wanted to let you know that Mindshare Partners offers a variety of training and advising resources, as well as other free resources on our website to help support you as a manager and to support your teams in creating a mentally healthy workplace. Our training is for managers like you. It's also for teams and for senior leaders. The advising services we offer can help coach leaders, can help set up communications campaigns or employee resource groups, and help you think really concretely about how to make change within your organization and embed a culture of support for mental health throughout your team and your organization. Many of our free resources include things like toolkits around communications or employee resource groups. We also recently launched an employee resource group community that you can check out more information about on our website. We also have articles that share helpful stories and tips for thinking about how to support mental health in our sections in Forbes and Thrive Global, and in other resources like the Harvard Business Review. Check out all of this at the links that are here and at our website generally. And also feel free to reach out to connect@mindsharepartners.org if you want to learn more about how we can help your company or your team. It's been a joy to talk to you all today, and we just want to say thank you. And also flash forward to a couple of the other webinars that exist in Thrive in Your Workplace so that you know what else is available to you. So Thrive in Your Workplace offers additional webinars that are listed here. Please feel free to visit their website and check them out to learn more. Thanks again.